My name is Thomas Sumstein, and I'm certified to practice basic life support as an emergency medical technician basic in Orange County, California. In this video, I will be sharing what I've learned about bleeding control. I'll demonstrate the skill with makeshift supplies as if it were an actual emergency without access to proper supplies. An average adult can lose 1 liter of blood without being endangered, but uncontrolled blood loss can potentially lead to death. I'm going to mark myself red in a spot and pretend that it is a wound. We'll proceed from there. If you or someone around you is experiencing bleeding and there are others nearby, have someone nearby bring a first aid kit. Make sure you are wearing personal protective equipment. Got a mask, just in case there's blood splatter. You don't want contamination. I'll be wearing shades. And I've got gloves. If nobody else is around, or if a first aid kit is on the way, you want to apply pressure to the wound, ideally with sterile, dry dressings, but with only your hands if you don't have access to first aid supplies. In this example, I will be using a t-shirt. Make sure it's clean. Try to stop the bleeding by applying pressure to the wound with clean dressings for 5 minutes. If the bleeding stops after 5 minutes, clean the wound with rubbing alcohol and apply a bandage over new sterile and dry dressings. If the bleeding does not stop after 5 minutes and the wound is on an extremity, apply a tourniquet. A properly applied tourniquet will be placed above a wound on an extremity and cut off circulation for the extremity below the tourniquet in order to stop the wound from bleeding. If you don't have access to a medical tourniquet, you can make one with objects around you. In this example, I will be making a tourniquet using a bandana and chopsticks. Tie the strap 2 inches above the bleeding wound on your extremity. I'll be tying a knot. Apply the handle to the strap and twist the handle to tighten the strap. In this case, with the knot, I did 1 tie. Now I'm going to have the handle within that before I tighten the knot. I'm going to have it within the second tie. Now I'm ready to tighten. Now you can twist the handle. You'll know the tourniquet is tight enough when you can no longer feel a pulse on this extremity. To learn how to feel a pulse on an arm, watch my other video called Assessing Vital Signs Without Medical Equipment. If you've got it to work and you can't feel a pulse, the next step is to secure the handle within the strap. But for now, I'm just working on pinning the handle. I want to get it tight enough to test if it did cut off my circulation. So I'm pinning it just in my armpit right here, testing this tension, checking my pulse. going to use my other arm as comparison. Get strong pulse on this side. And it's working. It's definitely working. So in that case, I move the handle so that I have more on this side and less on this side. It makes it easier to fold this portion on the handle underneath this portion of the strap. So I'm just going to twist it that much more. I'm going to try to get it to hold in there, and then I'm good. Then I'm done. Okay, I got it in a little bit, so then I'm going to actually push the rest through. You just want it to be able to hold itself, secure itself. There you go. Excellent. It's important to mark the time that you applied the tourniquet. Remember that time. If you can write it down, please do. Write it on yourself, write it on the patient. These are easily accessible supplies that a lot of people can carry with them into a lot of places. Being able to make a tourniquet could save a life in an emergency. So that's it for this video. Hope you learned something that could help you and somebody around you. See you in the next video.